Welcome to Fast and Furious MCQ edition.
Let's learn about the ophthalmoscopes. In ophthalmoscope, we have direct and indirect ophthalmoscope. To remember the difference between the direct and the indirect ophthalmoscope, we have this picture mnemonic, the movie of Dev, which is almost released in all languages and acted by Hero Karthik. Here, D stands for direct ophthalmoscope and E stands for erect images and V stands for virtual image. That is, in direct ophthalmoscope, the images are seen on erect and virtual, whereas in case of indirect ophthalmoscope, the images are inverted and real images. And in direct ophthalmoscope, the area of field of focus is 2 disc. This also can be remembered as in the Dev movie is available in the 2 disc, part 1 and part 2. So the field of focus is at the level of 2 disc in case of direct ophthalmoscope. In case of indirect ophthalmoscope, the area of field of focus is 8 disc. And in case of direct ophthalmoscope, there it is high magnification power, that is 15 times higher magnification power. Whereas in the indirect ophthalmoscope, there will be 4 to 5 the magnification power. And the disadvantages or drawbacks of direct ophthalmoscope is it can't be seen in case of hazy media. If the eye is hazy, the inside pathology can't be seen with the help of direct ophthalmoscope. In that case, if the patient is having an hazy media, the indirect ophthalmoscope is preferred. And in case of direct ophthalmoscope, it is placed as close to the patient, so it does not require any condensing lens. And the stereopsis cannot be seen in case of direct ophthalmoscope. Stereopsis means the depth of the object, and the depth cannot be seen with the help of direct ophthalmoscope. This is the real images of direct ophthalmoscope and indirect ophthalmoscope. See, in case of direct ophthalmoscope, it is placed as close to the patient. The examiner and patient is as close. In case of indirect ophthalmoscope, the patient and the examiner are at the 1 arm distance, and because it is as close to the patient, the direct ophthalmoscope does not require any condensing lens, whereas in the indirect ophthalmoscope we require this condensing lens. And the direct ophthalmoscope, the field of vision is up to 2 disc diopters, and it is seen up to the level of equator. And in case of indirect ophthalmoscope, it is 8 disc field of vision, and it is seen at the level of ora serrata. In case of direct ophthalmoscope, we will be having the erect and virtual images. In case of direct ophthalmoscope, the images will be erect and virtual. In case of indirect ophthalmoscope, the images are real and inverted. In direct ophthalmoscope, the magnification power is 15. In case of indirect, it is 4 to 5. And this can't be used in case of hazy media, and direct ophthalmoscope is used in case of hazy medias. And stereopsis cannot be measured with the help of direct method. In indirect ophthalmoscope, stereopsis is used. These are the difference between direct and indirect ophthalmoscope.